The pharmacotherapy for controlling the obesity should be started when the lifestyle modifications gets failed. So first we have to advise the lifestyle modifications. If they are failed, then only we have to start the pharmacotherapy for obesity. The lifestyle modifications includes lifestyle modifications to control the obesity includes one is diet therapy. The other one is promoting physical activity, and the third one is behavioral therapy. Under diet therapy, we have to advise for females, daily calorie intake should be around 1200 to 1500 kilocalories per day, and for males it should be about 1500 to 1800 kilocalories per day. Even after this lifestyle modifications, if the patient cannot lose weight, then we have to start the pharmacotherapy. And the other indications for starting pharmacotherapy includes when the BMI of an individual is greater than 30 kgs per meter square, or BMI greater than 27 kgs per meter square with concurrent obesity related complications. So when the diet therapy, physical therapy and behavioral therapy, that is lifestyle modification, fails, then we have to start pharmacotherapy. Or when the BMI of the individual is greater than or equal to 30 kg per meter square, or when BMI greater than or equal to 27 kg per meter square with associated obesity related complications, then we have to go for pharmacotherapy, that is anti-obesity medications has to be advised. These anti-obesity medications are divided into two groups primarily. Those are centrally acting drugs, and the other one is peripherally acting drugs. Under centrally acting drugs, these drugs act by increasing the neurotransmission of monoamines like norepinephrine, dopamine, and 5-hydroxytryptamine, which is serotonin. 5-hydroxytryptamine is serotonin. Under centrally acting, we have mainly two drugs, that is Phentermine. It is a drug used in combination with topiramate, which is an anticonvulsant. Topiramate is also used in the treatment of migraine prophylaxis. So Phentermine and topiramate combination is used as a centrally acting anti-obesity drug. Here the mechanism of action is Phentermine. It is a sympathomimetic drug. Which increases the neurotransmission of these monoamines, thereby decreasing the appetite, resulting in weight loss. And the other one under the centrally acting drugs are lorcaserin. Lorcaserin is a selective 5-hydroxytryptamine, that is serotonin 2C, 5-hydroxytryptamine 2C receptor agonist. 5-hydroxytryptamine 2C receptor agonist, lorcaserin. It was actually FDA approved in 2013, but it was later withdrawn from the market by the FDA itself in the year 2020, FDA withdrew this drug from the market in the year 2020 because it has carcinogenic risk, particularly colorectal cancer and pancreatic carcinoma. So it has a tendency to develop pancreatic carcinoma or colorectal carcinoma. So the FDA recommended withdraw from the market. Then peripherally acting medications includes Orlistat. This Orlistat is a synthetic hydrogenated derivative of naturally occurring lipase inhibitor, lipostatin. It is a lipase inhibitor produced from fungus, that is mold, Streptomyces toxytricini. It is derived from the mold Streptomyces toxytricini. Apart from this centrally acting and the peripherally acting anti-obesity drugs, there are certain other drugs also which are in the development phase. They are bupropion. It acts by dopamine and norepinephrine reuptake inhibitor, bupropion. This bupropion is also used in smoking cessation. The other drug in the development is Naltrexone. This Naltrexone, it is a opioid receptor antagonist, which is used as anti-obesity medication in the near future. This drug also plays a role in controlling the alcohol dependence. The other drug is liraglutide, which is a GLP-1 agonist, and also semaglutide, which is also used in chronic weight management, which is also a GLP-1, glucagon-like peptide 1 receptor, GLP-1 receptor agonist. These drugs acts on the arcuate nucleus in hypothalamus and causes decreased feeding, thereby promoting the weight loss. So these are the